Hello, and welcome to today's online information session about UC Berkeley Extension's certificate program in the treatment of substance use disorders. I'm Cindy Hong, the Program Director of Behavioral Health Sciences here at UC Berkeley Extension. Thank you for joining us today. I'll start my presentation by discussing the need for qualified and certified substance use counselors, how our certificate program meets that need, outcomes for our graduates, and then how you can become a part of this exciting, career-changing program. I encourage you to submit your questions at any point during the presentation. I will answer each of them as time allows or respond after the presentation via email. Please bear in mind that some of your questions may be addressed in content presented later in the talk. So let's get started. Let me jump right into the primary reason we're all here today. That is because substance use disorders are a huge issue that affects millions of our families, our workplaces, our healthcare, and the criminal justice and social service systems. Behavioral health issues are being addressed and often covered by our healthcare systems. Today, individuals and families are offered services in clinics and programs that are either in alcohol and drug-specific treatment settings or, more frequently, addressed in health and mental health programs around the country. One of the most exciting aspects of the field of addictions policy and practice in the 21st century is the growing awareness that treatment works and that evidence-based prevention and treatment of substance use disorders can improve outcomes and give hope to millions. I likely don't need to tell this audience that substance use disorders are a critical issue on the public agenda and have an enormous impact on all of our communities and on all of our lives, both personally and professionally. The prevention and treatment of substance use disorders is also being integrated into the world of health and mental health services. There is a growing interest in the general public and among professionals involved in the treatment and recovery movement to help individuals and families face their addictions head-on and seek their own unique pathways to recovery. The exciting thing about this field is that it is growing and in flux. There's no question that parity legislation and the Affordable Care Act did a great deal to move the country forward in terms of providing coverage for treatment for behavioral disorders through Medicaid. In California, Prop 36 passed a number of years ago. Although still not fully funded, it indicated a strong preference in California to view addictions as a public health matter and not one solved by incarceration. Most healthcare systems are taking behavioral health, including alcohol and drug use, very seriously, and they view this disease as an important factor in identifying and helping prevent a wide range of related health problems. And it saves healthcare money over time and can reduce the family, social, and individual consequences of an addiction that's not being addressed in its earliest stages. Parity legislation has also made treatment of mental health and substance use disorders a big part of what health insurance needed to cover. We've also seen heightened awareness, interest, and support for prescription drug use treatment in recent years. Licensure and credentialing requirements for addictions counselors vary in most states across the country and are still evolving in California. While there is no professional licensure for addictions counselors in the state, there is a very strong certifying body that UC Berkeley Extension works with directly, the California Consortium of Addictions Programs and Professionals, known as CCAP. UC Berkeley Extension's certificate program meets and exceeds the educational requirements of CCAP. Most of our certificate graduates become CADACs, Certified Alcohol and Drug Counselors, and work in healthcare, mental health, or specialty treatment settings, both residential and outpatient. Prison populations are still made up of large numbers of people who are incarcerated due to drug and alcohol-related offenses. While some receive addictions treatment while incarcerated, many often need continuing care and support once released that will help them maintain a behavior pattern that reduces the risk of recidivism. Finally, It is important to note that there is a lot of significant research being conducted in this field based on neuroscience studies of the brain, as well as treatment outcome research. Many of these findings have policy implications, such as those recommended in 2016, first of its kind Surgeon General's report. Scientific American recently came out with a major cover story on how using brain scanning techniques track alcohol and drug stimulation's impact on the brain before, during, and after treatment and recovery. Other socio-behavioral studies have examined the most effective interventions that work best at different stages of recovery or with specific populations across gender, age groups, and ethnicities. Others examine the critical role of medication-assisted treatment that can significantly reduce cravings. It is this kind of research and information that you're going to be learning about in our courses to help you become a knowledgeable and effective professional addictions counselor. Now on to the job market. According to the Bureau of Labor Statistics, a number of positions in the substance use disorders and behavioral health counseling fields is estimated to grow over 20% through 2028. The field continues to grow faster than the average of other occupations, especially as mental health and substance use is recognized as a significant cause of other health problems, and health insurance increasingly covers the full range of problems. We not only see this growth rate due to increased coverage, but also due to the growing awareness of the need to provide services for the current prescription drug use epidemic across the country. Healthcare systems are highly motivated to treat opioid and marijuana problems, and our certificate program addresses this issue directly, while also continuing to focus on alcohol and other drug problems. Current estimates are that more than 2 million Californians are in need of treatment for alcohol use, and over 750,000 for drug treatment. And recent studies have indicated that while there are well over 30 million adults nationally seeking treatment, the majority of those struggling with substance use disorders never receive treatment. So there is great need to increase the number of treatment options nationally, and certainly in California. Under ACA, some 6 million additional folks have become eligible to receive coverage for behavioral health interventions. It is expected that this kind of coverage will remain an integral part of healthcare reform in the U.S. The economic costs to society for alcohol and drug-related problems are enormous, well over $52 billion per year in California and over $520.5 billion nationally. While the exact number of those suffering from substance use disorders may be hard to ascertain, it is estimated to exceed nearly 10% of the U.S. population, many of whom never seek or receive treatment. While over half the cases in the Child Protective Services system, as well as an incidence of domestic violence, are alcohol and drug-related. Absenteeism and DUIs take a huge human and economic toll on our communities and workplaces, and substance use problems continue to heavily impact the criminal justice and healthcare systems. So, what can you expect starting a career in this field? The median pay increases each year over the $44,630 estimated in 2018. Given a fairly high annual turnover rate in the field, job listings seem to be consistently available, partly because as addictions counselors leave, new people are hired. Professionals who have received a good education and have strong supervision tend to have the ability to stay in their positions, don't experience as much stress and burnout, and end up moving up the ladder fairly quickly. And these folks are working at some of the best programs and agencies that provide substance use services. So the outlook will certainly continue to be strong in California as well as most other states. So how can UC Berkeley Extension's certificate program in the treatment of substance use disorders help you achieve your career goals and become competitive in this growing, exciting, and challenging field? UC Berkeley Extension is the continuing education arm of the flagship campus, UC Berkeley. Since 1891, we've been assisting students in reaching their professional goals and accomplishments. We offer more than 65 professional certificates and specialized programs, and more than 2,000 classroom and online courses, with 45,000 enrollments each year. We pride ourselves on academic excellence. All of our courses and instructors, as in this certificate, are approved by the appropriate campus department. This certificate program and all courses and instructors are reviewed by UC Berkeley's School of Public Health. Our certificates require academic advisory boards comprising campus faculty and industry leaders who review the curriculum to ensure that it's up to date and in touch with emerging trends and hot topics. Our instructors, most of whom work in the field, also bring their real-world experience to the classroom. So when you enroll in a UC Berkeley Extension course, you are guaranteed a real-world professional education along with Berkeley quality curriculum. So let's focus on the certificate itself. It is one of the oldest and most respected in the state, now in its 4th decade. The curriculum in our certificate program meets and exceeds the requirements of the California Consortium of Addiction Programs and Professionals, or CCAP, for students like yourself who want to enter the field. So your path will include completing our courses, earning your certificate, taking their exam. Our students all tend to easily pass their exam, and do your internship hours and become a certified alcohol and drug counselor. And a UC Berkeley Extension certificate means a lot in this field. We have a great faculty with specialized expertise in substance use treatment and recovery. Our curriculum offers a very balanced approach, especially as our instructors tend to have different viewpoints on a variety of hot issues in the field, but all provide training using evidence-based practices. Our instructors are also very supportive. They want to teach. Most are working in the field and very much want to give back through their teaching efforts. They enjoy teaching a group of students like yourself, who tend to be a pretty great mix of those already working in the field and those who are seeking a career change. Many of the instructors and students involved in the programs are often in recovery themselves. So let's take a deeper dive into the actual curriculum. You'll take 14 required courses and 18 hours of electives. If you take 1 or 2 courses each term, even if you're working full-time or have strong family obligations in your life, you can still do quite well and finish your courses in about a year. In total, you'll receive 342 hours of instruction if you opt to not take the CCAP field seminar. If you do decide to take the CCAP field seminar, which most of our students do, you'll have 1 extra unit as part of the field seminar for a total of 357 hours of instruction. You'll also do a 255-hour internship during the seminar. The required courses are grouped in 3 different levels. We'll ask you to complete 1 level before moving into the next because sequential learning of both the concepts and intervention methods is something we strongly believe in. You'll take the Level 1 courses, which are mostly foundational, and then you'll move into more of the applied treatment side in the Level 2 courses. And then in Level 3, you'll take a summary course on counseling interventions and take the field seminar. Here is a list of the 4 Level 1 courses where you'll start your education. You can take these courses in any order, but you must complete all of these courses before moving on to the Level 2 courses. The first Level 1 course looks at the history of addictions around the world, examines the role of culture and this country's approach to using drugs and alcohol, all the way from prohibition up to the war on drugs, to Just Say No, to where we are today in terms of addressing issues of substance use disorders. The Integrated Behavioral Pharmacology course is one that draws people to the field. In this class, you'll learn about how brain chemistry impacts on addictive behaviors. The Introduction to Counseling Techniques gives you a strong foundation about how you work as a counselor in a clinical setting, and the Psychological Foundations covers a wide range of theories that apply to the work in substance use disorders. After you've completed all of your Level 1 courses, you'll move on to take these Level 2 courses, which you can also take in any order. These courses cover the range of interventions when working with families and groups. The prevention course, called Environmental Strategies, is a very important aspect of work in this field. You examine the role of media, the impact of a range of environmental strategies, and what people can do to prevent the most harmful effects of substance use disorders. The co-occurring disorders, continuing care, and diagnosis and assessment courses are essential to understanding how to prevent relapse and, of course, getting you familiar with DSM-5 and the mental health system. Both the group methods and family recovery courses address some of the most common treatment modalities in the field. An ethics course and a vital and popular evening workshop on self-care and career preparation are both part of Level 2 coursework. Finally, Level 3 includes 2 courses. The Counseling Interventions class helps you integrate what you've been learning throughout the entire program. And then the Field Experience Seminar, which most people take so they can move on to qualify for the KDAC track, requires being in 255 hours of field placement in an agency. We have a list of agencies that students may use to find an agency setting that meets their needs and which wants to take them on and supervise them in the real world of treatment while they are in class. You can also take the 2-unit version of the seminar without the fieldwork component and complete a small 36-hour project instead. We offer a range of electives. Here is a list of some of the most popular. They vary from term to term. You are required to take a total of 18 hours of workshops and can be taken at any time during the program. You can view all of the electives that we offer on the certificate's webpage. Most of the instructors in this program have clinical experience and are continuing to work in the field as addictions counselors or researchers, or are professionals in some way directly involved in the issues of substance use disorders and recovery. Here are a couple of instructors who you'll learn from. Dr. Karen Kaufman is a clinical psychologist who has been in private practice for more than 30 years in the Bay Area. She has provided individual, group, and family therapy for adolescents and their parents at Kaiser Permanente in Walnut Creek, and for adults with substance use disorders and their families at Kaiser in Oakland. Dr. Jimmy Turner is an Extension honored instructor and a professor of psychology at John F. Kennedy University. He has served as staff psychologist, director of training, and assistant program director for the Chemical Dependency Recovery Program of the Kaiser Oakland Department of Psychiatry for 23 years. For our classroom courses, you'll be learning in either our downtown Berkeley Center, which is a couple of blocks away from the Berkeley campus, or at our San Francisco campus in the Financial District. Both locations are easy to get to using BART, so you don't have to leave work early to get to an evening class. We also offer some courses on the weekends if that works better for you. So you might have a 6-hour Saturday class, 5 or 10 weeknights for a 15 or 30-hour or 1 or 2 unit course, or even a mix of weekends and weeknight classes. Many of you are wondering, what do your graduates go on to do? We're always super proud of our students' success. They work at a range of some of the most respected agencies and programs in the Bay Area and beyond. Mark Langton recently completed the certificate and is now a staff counselor at Olaf Recovery Programs in San Francisco. Debbie Bonjour received her certificate with distinction and is now a co-occurring specialist with the Greater Hope Project in Hayward. Therese Becker complemented her master's in marriage and family therapy with our certificate program and is a behavioral health clinician at Contra Costa Behavioral Health. You can read more about their journeys and other graduates at our Voices blog on our website. So, how do you get started? We require that you have a high school diploma or a GED and 2 years of college coursework. We ask all students who have worked through their recovery to have done so at least 2 years ago, so you're really able and willing to work on someone else's recovery and move forward as a professional in the field. You'll need to create a free student account through our website. You'll use this account to enroll and pay for your courses, schedule your exams, find out about your grades, and track your progress through the program. It also gives you access to our certificate resource site with course syllabi, volunteer opportunities, job listings, and other news in the field. Probably one of the biggest benefits is that you pay as you go. You don't pay for the entire program at once. You pay for each course one at a time. Our prices vary based on the course, and in total, taking all of the certificate courses costs around $6,300. And that does not include your textbooks or the one-time $150 certificate registration fee. You have up to 5 years to finish the program, so you can take it at your own speed, since most adult learners are working and/or have family obligations that don't allow them to be full-time students. The average time students take to complete this program is about 2 years. We also suggest filling out our newsletter sign-up form. You'll receive monthly emails about upcoming courses and new blog posts. Earning the certificate is a simple 3-step process. First, you'll register for the certificate and pay the non-refundable registration fee. We recommend you do this before starting your second course in the certificate. Next, you'll complete all the courses with a grade of C or better within the 5-year time period. Lastly, once you've completed all of your courses, notify the department to request your award. Here are some frequently asked questions. Is this program online? No, but Integrated Behavioral Pharmacology, a Level 1 required course, is available online. None of the other courses are available online at this time. Are these courses or credits transferable to other degree programs? Yes, by all means. All of the credit classes are upper division UC Berkeley School of Public Health courses, which carry full academic credit. UC Berkeley Extension credits usually travel very well and are often accepted by other degree-granting institutions for upper division credit towards completing your degree. When should I start looking for my internship? You don't need to start your internship until you are enrolled in the Level 3 field seminar. However, it is great to start looking now. We have a list of current and recent agencies where students have done their internships. Our students are in demand, so it helps to start your search for a good placement that fits your needs and goals soon after you start your coursework. I must also add here how important it is for all of you, especially if you are a career changer, to start volunteering now. Can required courses or the elective workshops be substituted? Up to 25% of the required coursework can be substituted if requested in advance of your registration and approved by the director. Courses must have been taken at an accredited college or university, and a grade of C or better must have been earned. Electives may not be substituted. How much homework will I have? A student is expected to prepare for class readings, write papers, and take midterms or finals in most credit courses. Most adult students do quite well mastering the material for their classes. Usually, one can expect 1 to 2 hours of homework per week for each hour you are in class. Is there financial aid for this program? Since this certificate is not a degree program, you are not eligible for federal aid. However, some students do receive Department of Vocational Rehabilitation funding. Others have received support from their agencies if they are working in the field. If I haven't been a student for several years, what can I expect the classroom experience to be like for me? Well, you won't be alone. Most of our students are adult learners and find themselves in a new role, but they bring their life experiences with them, which makes the coursework, readings, etc. come to life and make course material much more accessible and assignments much easier to complete. I work during the day, so how many classes should I take? Most of our students have family obligations or work full-time and manage quite well taking at least one course per semester. Some are only 1-day or 1 to 2 unit courses, so working students can take up to 2 to 3 courses per semester and do just fine. Students take courses at their own pace, based on their own financial and personal situations. Unfortunately, that's all the time we have to take your questions. But if you have any additional questions that I wasn't able to answer, here is our contact information. We would love to hear from you and discuss how this certificate or individual courses can help you become a qualified and knowledgeable drug and alcohol counselor. I also suggest filling out our newsletter sign-up form on the website. You'll receive monthly emails about upcoming courses and new blog posts. Thank you again for taking the time to learn about our certificate and course offerings in the treatment of substance use disorders. And I look forward to seeing you in one of our classrooms.